Hello, and welcome to today's health feature. In this episode, we're taking a closer look at a painful and surprisingly common condition, peptic ulcer disease. What causes it? What are the signs to watch out for? And how can it be treated or even prevented? Let's explore everything you need to know in just 10 minutes. Peptic ulcer disease, often abbreviated as PUD, refers to open sores that develop in the lining of the stomach, the upper part of the small intestine, or less commonly, the lower esophagus. There are two main types: gastric ulcers, which occur in the stomach, duodenal ulcers, which occur in the first part of the small intestine, the duodenum. These ulcers form when the protective mucosal lining of the digestive tract is damaged, allowing stomach acid to eat away at the underlying tissue. Peptic ulcers are not caused by stress or spicy food alone, as once believed, although these can make symptoms worse. The primary causes are much more specific. The two leading causes of peptic ulcers are 1. Helicobacter pylori, H. pylori infection. This bacteria weakens the mucus layer that protects your stomach and small intestine, making it easier for acid to create ulcers. 2. Long-term use of NSAIDs, non-steroidal anti-inflammatory drugs. Medications like ibuprofen, naproxen, and aspirin can irritate or inflame the stomach lining. Other risk factors include: smoking increases stomach acid and impairs healing. Excessive alcohol use weakens the mucosal barrier. Chronic stress may worsen symptoms. Corticosteroids, when taken with NSAIDs, can raise ulcer risk. Genetics of family history may predispose someone. Many people with peptic ulcers may not experience noticeable symptoms at first. However, when symptoms do appear, they can include burning stomach pain, often between meals or at night, pain relieved by eating or taking antacids, bloating or feeling full quickly, nausea or vomiting, dark, tarry stools a sign of gastrointestinal bleeding, weight loss without trying, vomiting blood in severe cases. If left untreated, ulcers can bleed, perforate the stomach wall, or cause obstruction, leading to life-threatening complications. Diagnosing peptic ulcer disease involves a combination of patient history, symptoms, and diagnostic tests. Common diagnostic tools include 1. Upper endoscopy, EGD. A flexible tube with a camera is inserted through the mouth to view the stomach and duodenum directly. 2. H. pylori testing, via breath test, stool antigen test, blood antibody test, biopsy during endoscopy. 3. Barium swallow, upper GI series, X-rays after drinking a contrast liquid to view ulcers. 4. Stool test to check for signs of bleeding. A precise diagnosis is essential to rule out more serious conditions like stomach cancer and to guide proper treatment. Treatment depends on the underlying cause. If H. pylori is the culprit, triple or quadruple therapy is used, combining 2 or more antibiotics, EDANT, a proton pump inhibitor, PPI, like omeprazole or lansoprazole, CE, sometimes bismuth, Pepto-Bismol. If caused by NSAIDs, discontinue or reduce NSAID use. Start PPIs or H2 blockers, like ranitidine if available. Use protective agents like misoprostol in high-risk patients. Pain relief and healing generally occur within a few weeks of starting treatment. Follow-up may include a repeat endoscopy, especially in gastric ulcers, to ensure healing. In rare cases where ulcers bleed or perforate, emergency surgery may be needed. Preventing peptic ulcers involves a combination of medication safety and lifestyle choices. Avoid unnecessary NSAID use. Don't take NSAIDs on an empty stomach. Limit alcohol and stop smoking. Manage stress effectively through mindfulness or therapy. Eat smaller, frequent meals. Wash hands well and eat safely to prevent H. pylori infection. If you're prone to ulcers or have a history of H. pylori, your doctor may suggest prophylactic PPIs during NSAID therapy or regular monitoring. Peptic ulcer disease is painful but treatable, and in most cases, completely preventable. By understanding the causes, recognizing symptoms early, and taking care of your digestive health, you can avoid serious complications and live ulcer-free. Thanks for listening. Stay informed, stay healthy.